Hi friends, welcome to this new video of MCQs. Today in this video we will be discussing a further set of MCQs. This is also a set of 10 MCQs and we will try to discuss and also solve them, so please stay with me. Now our first MCQ of this video is: all of the following statements are correct regarding vitamin B12 except option A is can be stored in the liver for years, an essential water soluble vitamin, requires heptocurine to protect it from stomach acid. D option is requires intrinsic factor for absorption, and E option is cannot be stored in the body. Now actually we know that vitamin B12 can be stored in the liver for years. So actually all these statements are correct but one, and that is E. This statement is not correct about vitamin B12, as it can be stored in the body for years. Now our second MCQ: the most common and most important of all conjugation reactions of drug metabolism is sulfuric acid conjugation, acetic acid conjugation, amino acid conjugation, methylation, and glucuronidation. So the correct option in this is glucuronidation. This is actually the most common and most important conjugation pathway of drug metabolism. So glucuronidation is the correct answer here. Now the third MCQ: cytochrome P450 isozymes contains in them iron, cobalt, magnesium, copper, and manganese. Now the correct option is iron, as cytochrome P450 isozymes contains in them iron. Now moving on to the fourth MCQ: one of the following isozymes is responsible for the vast majority of cytochrome P450 catalyzed reactions. So among the below given options, one option is there that is actually responsible for the vast majority of cytochrome P450 catalyzed reactions, and that is, the options are there. The correct option is cytochrome P3A4 and cytochrome P3A5. These are actually the two isozymes that are responsible for the vast majority of cytochrome P450 catalyzed reactions. Now moving on to the fifth MCQ: one of the following isozymes is not very susceptible to enzyme induction, which makes it free of the possibility of drug interaction. Actually a drug interaction occurs when one of the drug can induce or inhibit a certain cytochrome P450 isozyme form. If a drug is not inducing or inhibiting a certain cytochrome P450 enzyme, then a drug interaction with that drug is not very much possible. So in this MCQ we are asked about a certain isozyme form of cytochrome P450 that is not very susceptible to enzyme induction. That means that it is very much stable in the face of drugs, certain drugs, meaning that it is not actually inducible or inhibitable. So this specific isozyme carries with it the property that it is free of the possibility of drug interaction. So among these options, the correct option is cytochrome P2D6. This is actually the specific isozyme form of cytochrome P450 that is not very susceptible to enzyme induction, and thus it is free of the possibility of drug interaction. So any drug that is actually carries its function via this enzyme. So another drug, if you co-administer it with the first one, that is with the one who is carrying its action via this isozyme, so in such case the drug interaction will be minimum or not at all there. Now the sixth MCQ. Glomerular filtration rate in a normally functioning healthy renal system is, in this MCQ we are actually asked about the normal GFR value, which is 120 ml per minute. The correct option is 120 ml per minute. So now we know that the normal GFR value is 120 ml per minute. Now moving on to the seventh MCQ of this video. The disintegration time or DT of orally dispersible tablets or ODTs is immediate upon contact. B option is within half a minute, within a minute, within a minute and a half, within 2 minutes. Now the correct option here is within half a minute. Orally dispersible tablets disintegration time is approximately 30 seconds, not more than 30 seconds. That is within half a minute. Now the eighth MCQ. A drug reaches its steady state plasma concentration in about how many half-lives? We actually know this, that it takes about 4 to 5 half-lives for a drug to reach its steady state plasma concentration. So the correct answer is C. Now the ninth MCQ. The only determining factor of the time it takes to reach steady state plasma drug concentration is rate of infusion, half-life, clearance, volume of distribution, and dose of the drug. So actually we know also from the previous MCQ that the factor that determines the time it takes to reach the steady state plasma concentration is actually half-life. It takes about 4 to 5 half-life for a drug to reach its steady state plasma concentration. So the correct option is B. Now moving on to the last MCQ. If doses of a drug are given at its half-life, then 75% of the steady state plasma concentration will be reached with its first half-life, second half-life, third, fourth, or fifth. So actually we know that if we give the doses of a drug at its half-life, then 50% of the steady state plasma concentration will reach after the first half-life, 75% will reach after the second half-life, and so on and so forth. So the correct option in this is B. 75% of the steady state plasma concentration will be reached after the second half-life of the drug. So this was all for now, friends. Thank you. Thanks for watching. And please subscribe to my channel if you would like to get notified for more upcoming videos like this. And also one thing more, friends, if you have any confusion or question, or if you would like me to clarify or explain a bit further some point in this video or in some other video, then please do tell me in the comment section below, and I will get to you as soon as possible, and I will try to solve or answer your query to the best of my knowledge and ability. So thank you very much. Thanks for watching. Thank you.